just returned from the TCT symposium, and as usual, there were many new developments. The main buzz was about FDA approval of the Edwards Sapien transcatheter aortic valve for use in inoperable patients, and operators wasted absolutely no time. The first commercial use of the valve occurred 2 days later. While I am on that subject, the PARTNER 2 trial also gained approval, a trial in which patients who are at far lower risk, that is an STS score of only 4 or more, will be randomized to either surgery or transcatheter aortic valve replacement. That will indeed be an interesting trial, as the population of patients who are potential candidates for transcatheter therapy move into what we all thought would remain the domain of the cardiac surgeons. 2 trials captured my attention. The first was a trial called 20, comparing the xadarolimus-eluting Resolute stent versus the everolimus-eluting Xience 5 stent. Patients with stable angina or non-ST segment elevation MI were studied. Xadarolimus-eluting Resolute stents were non-inferior to the everolimus-eluting Xience 5 stents in terms of safety and efficacy for treating real-world patients with a vast majority of complex lesions and off-label indications. That trial showed a low stent thrombosis rate for both stents without significant difference between groups at about 1% per year. So for choosing between these stents, it is a dealer's choice. The second was the BRIDGE trial, the results of which support the hypothesis that IV cangrelor is a feasible and safe management strategy as a bridge to cardiac surgery in patients who require prolonged platelet inhibition after thienopyridine discontinuation, patients with stents, for example. The good news in this trial is that there is rapid offset of antiplatelet effect after intravenous discontinuation before surgery, and intraoperative bleeding did not seem to be a major problem. This is perhaps good news for patients with acute coronary syndromes who need cardiac surgery after early treatment with PCI and stenting, but that trial will still have to be performed. I'm Peter Block, and this is a CardioSource Partner.